I love Thursday nights. Thursday night sleep apnea learning nights. Hello, everybody. What are y'all up to this Thursday night? I'm so happy a few of you are settling in right now to watch our amazing Take Two broadcast, Telemedicine with Dentistry. We have a few of you who have already introduced yourself. Brenda Jungler says, hello from Edmonton, Alberta. Brenda, we're excited to see you. She says, I'm so excited for this episode. You should be, because it's going to be awesome and filled with so much great information. Brenda, it's always good to have you along. And look at this. Natalie Grace, hello from Brisbane, Australia. Tammarie, do you know Natalie? Thumbs up. Tammarie's in the thumbs up. Tammarie's in the virtual green room right now, and so is Dr. Sahil Chopra, who is unbelievable and going to be talking to us about telemedicine tonight. As I say hello to all of you joining us from clearly all over the world tonight as we prepare for, we called it Take Two, Telemedicine with Dentistry, because for those of you who were at the Breathing Wellness Conference with us in Las Vegas, Dr. Heit and I, along with Dr. Chopra, well, we went for it. We attempted things in broadcast land that big television stations don't even attempt. Technically, we had it all going on. It's just that the all didn't want to cooperate with us. So we had a live broadcast in the room. We were broadcasting out to you in the world. And unfortunately, there was a lot going on. It didn't quite work out as we hoped. So we had to do a do-over. The information is just so good. Wait till you hear from Dr. Chopra and, of course, Dr. Tammarie Heit and what they have to say about telemedicine and how it's going to open up the treatment of sleep apnea. It's a game changer, and it's information you all need to hear. But unfortunately, there was lots of technical difficulties, and we didn't quite get that message out to the world the way we wanted to. So we're going for it again, because we know that you want to hear it. The information is great, and it's going to be packed with so much learning over the next hour. For those of you who are watching, please go ahead and introduce yourself, because chances are Dr. Heit and Dr. Chopra know you, because the medical community is small, especially the sleep apnea community, and we're trying to get everybody to work together on this. So please let us know where you're joining us from and maybe what your area of expertise is, so we can connect this community in any way possible. In the interest of time, as I'm sitting here chatting, I think we should just dig in and make this happen. And so I'm going to welcome all of you tonight to our live broadcast. It really is another important piece of a puzzle in this conversation as we bring together the diagnosis and the treatment of sleep apnea. You've heard me talking about Dr. Tammarie Heit and Dr. Sahil Chopra, who will be joining us momentarily. They are two leading experts in their field, and tonight the focus is on telemedicine. One of the biggest challenges for patients when they discover that they have a sleeping disorder, honestly, it's just accessing a specialist for diagnosis, and then counseling for obstructive sleep apnea. How do you get access to that doctor? What do you do with that information? The hope through this subject and all of the broadcasts that we've been doing to date is that everybody can work together on this to further treatment, to further diagnosis. It's such a game changer in so many ways when all areas of medicine, all specialties of medicine work together. And the reality is patients can wait up to 3 months to see a specialist, but with telemedicine that can change all that, and you're going to hear how. So tonight we're going to talk about how you can help the breathing wellness movement by becoming part of the telemedicine dentistry for obstructive sleep apnea. Now, for those of you who don't know Dr. Sahil Chopra, he's a sleep specialist and intensive care doctor from California. Dr. Tammarie Heit is a general dentist from Canada, and they're going to explain, as I mentioned, how medicine and dentistry can work together to improve access for diagnosis and treatment of obstructive sleep apnea. And then they will demonstrate the use of a telemedicine platform in 2 countries to simplify and streamline healthcare. And this is so exciting. I'm just going to tell you today, I actually had like a telemedicine appointment for myself. It wasn't for sleep apnea or anything like that, but I had an appointment with my doctor, and I'm like, wow, like we're really moving forward, because before I would have to travel into her office, and honestly, it just took up so much of your day to get there and taking up her day. And just like that, you have an appointment, and within 20 minutes, you have the answers and you know what to do with that information. And it just streamlines everything. So I'm excited for you to hear what Dr. Chopra is up to, because it's game changing. It really is. I can see a number of you have joined in on the broadcast. As you do, can you please go ahead and introduce yourself and let us know where you're watching from, so that Dr. Heit and Dr. Chopra know who they're talking to, and chances are they likely know you as well. So this is, I believe, our 10th broadcast in our Science of Sleep Apnea ongoing series. As I mentioned, it's a redo of one that we did live from Caesar's Palace in Las Vegas, but the information was so important, we wanted to bring it to you again, because our broadcast, unfortunately, in Las Vegas had a litany of technical problems, and it happens when you're doing things online. So we're bringing it to you again. And let me just say this, all of the conversations that we have had to date in the Science of Sleep Apnea have been so insightful, powerful discussions, and we brought together dentistry with so many different areas of medicine. So if you're interested in watching any of our previous broadcasts, you can find them on the website, the scienceofsleepapnea.com. Go there. They all live there. You can also watch this broadcast there as well if you have to bow out during the middle of it, but don't. If you don't have to, stay with us, okay? But you can watch this one there as well, and all the ones that we have done in the past. So I invite you to go check out that website. And for your information, so far in this series, we've interviewed a cardiologist, a neurologist, a sleep specialist for both adults and pediatrics, a medical doctor, an otolaryngology, head and neck surgery. And we also had 2 of our previous guests join us in one of the broadcasts to talk about the AHI conundrum for diagnosis and follow-up of sleep apnea. That was such a powerful conversation. It's one that you want to watch as well. And coming up in a few weeks from now, can I spill the beans? I'm going to spill the beans. We're going to have an anesthesiologist join us and get his take on his perspective on patients that go under, who battle sleep apnea, and how medicine and anesthesiologists can work together. So that particular area of specialties. It's so great to be back with all of you again. My name is Carrie Dahl. I was a longtime medical reporter, turned 6 o'clock news anchor, turned public speaking coach and podcast host. And I love these broadcasts. I love the questions that are asked. I love how it brings people together. And the bottom line is, I love the impact this is having on patients and its ability to save lives in the end. And I know that that's what Dr. Heit is so passionate about. We want to say thank you, that we appreciate the time that you're taking tonight to watch the broadcast. And please, we welcome your questions. You all watching right now are way too quiet. I need to know who's watching, because I see a number of you, and I would love to know who you are, where you're watching from, and please weigh in the conversations. It is powerful to be able to have the ability to ask experts questions in real time. So take advantage of that over the next hour. We want this hour to be informative, to be interactive, for you to ask your questions, for you to learn, and to bridge the gap between medicine and dentistry. So the format for the next hour will look something like this. I'm going to begin by interviewing Edmonton dentist, Dr. Tammarie Heit, who has successfully reversed sleep apnea in so many of her patients. And then Dr. Sahil Chopra will follow Dr. Heit's presentation. And then I'm going to bring the two of them together so that they can ask questions of one another. And those of you in our live audience, you can ask questions of them. And then we will wrap up the evening by 6:30 Mountain Standard Time. And again, as I mentioned, for those of you who want to re-watch this broadcast, it will live on the website, thescienceofsleepapnea.com. So with that, let's dig in by welcoming Dr. Tammarie Heit, who, as I mentioned, is a driving force behind these broadcasts and so determined and passionate about fostering more collaboration between doctors and dentists in diagnosing sleep apnea. And as I mentioned, and ultimately in saving lives. Dr. Heit has spent the last 25 years working in general and craniofacial dentistry and lecturing worldwide for 10 years to dentists, orthodontists, and medical doctors on her published research and her findings. Dr. Heit has successfully reversed sleep apnea, which she will talk about. She is on a relentless mission, and I mean it. It's relentless. She is working tirelessly to get dentists and doctors to work together on the diagnosis and treatment of sleep apnea. Without further ado, here she is, but she's much too small, so let's make her look like this. Dr. Heit, oh, I love Thursday nights working together.
Me too. It's so much fun being here. And I'm very excited about this guest. And can't wait to just dig in.
And 2.0 for us, right? As I was talking about, like, we had such a fabulous presentation planned in Caesar's Palace in Las Vegas. And it was fun, but sometimes technology doesn't cooperate.
Yeah, and I love that episode, even though, we skip ahead 13 minutes into it but we did get it going. But I just wanted everyone to know, I want to keep this episode on the website because this is a learning thing for dentists and medical doctors. And I think everybody watching this should really consider doing something like this because that's how doctors and dentists get to know how each other thinks and, these experiences we're going through. And when we were up on stage there and we had that triple reverb thing happening, I was just like stunned, and you can see it in my face. And then I was laughing after, but we still got some information across. And
Yes.
Carrie, you're such a professional and you're so good at this. Like, you totally couldn't tell. Like, when I watched the episode, I go, how did she do that? Because there was all this echoing, and it was something new that I've never experienced. And then Dr. Chopra just seemed natural at it. Like,
oh gosh, yeah, you both were brilliant. You're being too hard on yourself. You were brilliant, but yeah, there was lots of technical issues. And remember, that's my background. I've dealt with that for 20 years, so it's not even fair to say that. It's just one of those things. We had the feedback and we rolled with it, but the information was definitely there. And I can't believe,
I'm not going to lie. Like, I was scared to watch that episode, but when I did, it reminded me of when I saw Daniel Craig for the first time in James Bond episodes, because I'm a huge James Bond fan.
Me too.
And I thought, he just looks like the other James Bonds. But then it turns out like he's the best one,
Yes.
So there's something about that damaged, tortured soul that's just raw and sexy. And that's kind of how I look at that episode. So if you want to know what I'm talking about, just go watch it.
Raw and sexy. Okay, let's run with that. I love it. I absolutely love it. Oh my goodness. Actually, I had a different reaction when I saw Daniel Craig. I was like, yes, he is the best James Bond, but I'm a huge fan. And I'm really, I can't say, did you see the latest episode, the latest James Bond? I can't say, I almost was like a spoiler alert. Shouldn't say what happens. So anyway, I'll stop right there. We're not talking about James Bond tonight.
I'm delaying that.
Exactly. You have to watch it. It's still in theaters. So I can't even believe that we've done 10 episodes to date. Like, yes. And so why? Tell me. I love this episode, and I told you this, and this is one of the reasons when I was going back to when I went to see my doctor for the whole medical checkup and everything, the yearly. And she said, "What have you been up to?" And I told her about these broadcasts that I was doing with you and the work that you're doing with sleep apnea. And she was like, "What?" She was like, "She's reverse sleep apnea." She goes, "So
Yeah.
she's family doctor." She goes, "Why do I not know about this?" And I was like, "What do you mean you don't know about this?" So I hand it to you. Why doesn't she know about this?
Well, it's a new seed. It's coming out. It starts with clinical results, and then you need clinical trials. And I'll just show you, my little path here. So for me, I've been doing this. I've been helping patients with craniofacial pain for 20 years, but this one came in about 10 years ago, and just with headaches. And so she didn't come to me really for her teeth. It was more for her headaches. And so you can see a difference in her face before and after treatment. So when we were documenting all these things, what ultimately happened is we grew her upper jawbone. And so now it's big enough to actually hold all those teeth. And then the bottom jaw can come forward, and that will decompress the jaw joints and help the whole posture decompensate and get rid of her headaches. So a dentist can really help patients, with pain, and it's repeatable. I was measuring the headache impact test scores, and I got this from a neurologist. So again, just communicating with medicine, and these headache impact test scores all came down. And, so this is a repeatable therapy that I did with. It's an oral appliance, a dental appliance that goes in the mouth, and you can take it in and out of the mouth. And it's a biomimetic appliance. And what it does is it corrects the craniofacial developmental deficiencies. So it will actually grow the bone volume of the maxilla, the upper jawbone. And you can see that in the face, because now the teeth have enough room to be straight and cosmetic and symmetrical and all those things that make a person beautiful. But if you grow that whole bone.
Dr. Heit, I have to jump in here, because also to the face shape changed, because that picture you showed us, her face was much more like, what do you call, like a half circle instead of like, it was so beautifully formed after she had that treatment.
Yes. So it's like a facelift when you grow the bone underneath that skin there. And part of that bone is the nasal airway. The hole in the bone is the nasal airway. And so, like, when I was treating patients for pain before, I wasn't really doing sleep studies because I wasn't thinking about it. But then as I collaborated with medicine, I realized that sleep apnea and pain are really connected. And so then I started looking at this anatomy. And in dentistry, now we can see so much more than we used to, like with this cone beam CT technology. Like you can't diagnose what you can't see, but we can actually measure that upper jaw grew forward, the bottom jaw came forward. And, this is what I see in my patient's mouth. So here's someone, I'm just like, okay, let's start measuring sleep apnea. So this person had quadruple severe sleep apnea, AHI of 118, severe is 30. And so look at her teeth. And this is what a dentist sees. If you think of the teeth and the jaws like a garage, and the tongue's like a car, before treatment with that crazy apnea hypopnea index, her bite is deep. So she's got like a 5-foot ceiling in that garage. And then after treatment, because the jaw expanded and it grew front to back as well as widthwise. So the bottom jaw is now able to come forward, and now she's got a 10-foot ceiling in her garage because her teeth are more end to end. And this is just phase 1 in dentistry. Naturally, the best thing would be to line up the teeth so all the cusps and fosses fit together. That's what the orthodontist can do very easily after phase 1. So phase 1 is get rid of the pain, get rid of the sleep apnea, and then phase 2 is line up the white things and make sure that jaw is in the physiologic rest position. So that's what you can do there. And so when her AHI went from 118 down to 1, like that's a serious cure. And we did that.
Can you explain that? When you say 118, what exactly does that mean?
Well, that
for
means
anyone who doesn't know.
Yeah. Well, this patient stopped breathing. If you go back to that last slide,
Mm-hmm.
she stopped breathing 118 times an hour. And frankly, she came into my office. She was sent to me by another dentist who said, just find out what's wrong with her. And so I just did a sleep study. And that's the result I got back. So I called the medical doctor and they go, oh my God, and got her in the hospital right away and then put that mask on her face. And then she every time she stopped breathing, she would get a breath of air from that mask. And I think the doctor who discovered the CPAP mask is Australian, like the guest we have on today. So there's lots of interest in that on the other end of the earth. But only 20% of people wear that mask. And so after she was really stabilized with it, she just came to me to see if there's something else we could do. And so that's when I did this boat therapy on her that grew her jaws. And naturally, she had to wear the mask. I said, I'm not doing anything with you unless you wear that mask because you're saving your life every night. But people who have sleep apnea, even if it's 30 and above, they're 5 times more likely to have a heart attack and stroke. I mean, just watch all the episodes. The medical doctors know the serious impact sleep apnea has on a person's health and longevity. But frankly, I think people are afraid to take sleep tests because they don't want to know the results. And because what do? Just get the mask? Yeah. So no, there's something we can do in dentistry. And, at the Breathing Wellness Conference in Las Vegas, a whole lot of dentists got sleep studies and a whole lot of dentists found out they had sleep apnea.
Yes.
So they're going to learn how to fix themselves. This is so easy. You can fix yourself, honestly, and you got to fix your family because who doesn't want to live a longer, healthier life? But
and have restful sleep. Yes.
I do sleep tests on everybody now. And the sleep technology is great. I'm going to show you. But like when you go to the next slide, just in a snapshot in time, and I think this is already 2 or maybe 3 years ago, you can see in the first graph, these are all pre-treatment patients and all those severes in the dark blue, and there's moderate and mild. And frankly, the mild ones are just going to progress to moderate and going to progress to severe. It's not a matter of if, it's when. But you can see in the post-treatment that we've reversed a lot of those sleep apneas in the graph. So, and then in dentistry, what we've been doing is just going, okay, what's happening with this face and with these faces? So we're taking different photographs before and after treatment. And this patient came to me because of jaw joint pain. And, I just used this device and his pain went away, even his jaw joint pain, because, if you grow the upper jaw, the soft tissue is more optimally positioned and the functional space there improves and the bottom jaw is able to come forward and that opens up the airway in the neck. So there's 2 spots. It really helps the airway. And I think that's how it reverses sleep apnea.
And this picture really paints a beautiful difference, like the before and after. It's very obvious.
Yeah, and like the jaw, the condyles of the lower jaw, that's the part that links up. It's like the bottom jaw hangs from the skull by a sling of muscles. And there's like a little brake pad between the two. And the condyle's the part that kind of articulates on the brake pad. And his are really degenerated. So now we can see that on some imaging, but that joint will regenerate through life. So if it's able to be decompressed, not only does the pain go away, but that bone can actually remodel and we can actually see it on those images you saw on the next slide.
Dr. Heit, look at this. I just got to bring this in. Natalie Grace, I think we've just changed your life, Natalie. She said, I have sleep apnea. I utilize the CPAP machine. Nobody has ever mentioned to me that dentistry could help. This is amazing to know. Natalie, welcome to a whole new world because this is life-changing work that Dr. Heit is doing. So,
and you can help, like we're at the point now where, when a dentist first comes out with something or a group of dentists, everybody challenges them and, oh, you're nuts. And this is a whatever thing. But now No, there's a big company developing, and we have an airway intelligence service. We're documenting everything. So, Natalie, what you can do is go to the Science of Sleep Apnea, and you could, you were interviewing like a neurologist and a cardiologist, and they're all like, just like you, like, I've never heard of this. Like, why don't I know about this? And that's what we're doing, is we're telling everybody. And now you can tell everybody, and you can go and tell your dentist, and tell your medical doctors. And what's exciting about today, and what's kind of exciting about the pandemic is it forced me to do teledentistry. So like,
Yes.
what happened to me? I'm in the middle of treating all these patients. What did I do? I did it from home, and these patients did it. And it was hysterical. There wasn't a single patient that didn't have a needle nose plier in their toolbox at home. Like, they just slammed all the clinics shut. I couldn't go in and treat these patients, adjust these appliances, but all those patients had a needle nose plier, and we did it together over the internet. Isn't that incredible?
It is incredible. And that's like the change that can happen. And
Yeah.
all through these conversations and what you're telling Natalie and what you've been talking about so far tonight, Dr. Heit, is just essentially how collaboration is key between general dentistry and all areas of medicine. So is this how you're visualizing that things can work, is through, telemedicine is going to be a game changer, isn't it?
Absolutely. Because, as you know, I was a nurse for 10 years before I was a dentist. And so I know that this is a medical condition. This sleep apnea is a medical condition that needs to have a medical doctor diagnose it. It is not something a dentist should diagnose. So a dentist needs to work with a medical doctor. And I've been blessed to work with Dr. Manisha Whitmans, who's a board certified sleep specialist in pediatrics. Can you imagine how lucky that is? The minute I started figuring out what we were doing with adults, you immediately want to prevent it from developing in kids. And there's a whole lot of dentists now that know how to do this. And basically, our goal is to grow those kids' jaws big enough so they don't need their wisdom teeth out, and they don't need braces. And I mean, you're not guaranteeing that, but just attempting it makes their case, makes them much healthier, because you can actually improve their airways. And so we're working together, making clinical trials and things. But while all that's happening, there's patients out there that want that treatment, because right now, no treatment for sleep apnea is just bad. And especially a kid growing who's got sleep apnea, and now we can measure it.
So what about adults? You go from the children, the way you need to, like, first of all, just recognize it, that it is sleep apnea, but let's move into adults.
Yes. So now I've got Dr. Chopra. And so Dr. Whitman's episode was, I think, episode 6. Just look on the Science of Sleep Apnea, look for her. You'll see about the kids. But this episode is very, very special, because when I was a nurse, I loved working in intensive care. And I know how special and smart Dr. Chopra is. And you're dealing with all the systems, multi-system, and you're dealing with all the social issues. And, a lot of your patients die when you work in intensive care. So your compassion, so that you're, there holding their hand, and it's just a part of life. And you just want to improve the quality of their life and the quality of their death and all these different things. So I know how special he is. But sleep apnea affects every single specialty in medicine. And Dr. Chopra knows that. And each of the specialists on these episodes know it. And it affects all their practices. I can't wait to get an anesthesiologist on, because how many people out there have surgery? And if you need a bunion off your foot and you have sleep apnea, or what if you need cancer off your foot and you have sleep apnea? Well, you have to offer for that safe. You can't just have it in an outpatient clinic. So there's a whole bunch of dynamics around this. And I think there's a whole lot of people that have sleep apnea and don't know they have sleep apnea. So if everybody just learns, they can help prevent it in themselves.
So this is how it starts, right?
Yes. Dentists are now required to screen for sleep apnea, just as we have to screen for cavities. That's how fast it's progressed. Like, now this This is a dental treatment for a medical condition, and now our governing body wants us to screen for sleep apnea. So that's huge. So dentists then have to learn. And so to diagnose sleep apnea, a medical doctor must have a sleep study. And this is the in-hospital sleep study, a level 1 sleep study on an adult and a kid. You can imagine the quality of sleep you're going to have in a hospital hooked up to all these wires.
Yeah.
And it's really super expensive. And so then the technology improved, and now we have level 3 sleep studies, which is like a take-home sleep study.
Mm-hmm.
And at first you couldn't even do these on kids, but the technology improved some more, and you could do these sleep studies on kids at home. And then I worry about that little kid on the left there, because they can, kids with sleep apnea are really restless. And so she's going to get all wrapped up in those wires. And so I make the parents supervise that kid sleeping all night. So that's not usually that much fun for the parents. But now look at the technology on the right. We can use a ring on the finger.
That's the best. Yeah.
And you can even do this in 2-year-olds. So, this is really going to help medicine with diagnosis. And then and now the better technology there, a person can sleep.
That ring.
Yeah, that ring. You just connect it with your phone. You charge it up on your computer. You can sleep. It's really cheap. You can sleep with it a whole bunch of nights in a row. I can test my dental device with it. I will frequently use this ring and have the patient, test their sleep with their device, without their device, with the CPAP, with both of them, so we can adjust these devices and improve their health as we're developing the jaws. Because it takes a while to grow that bone.
Okay, so with all of that going on and doing the sleep studies, tell us how all of this information can be used with telemedicine.
Well, imagine you get your results from that sleep study, and if a medical doctor has an appointment like you were describing, you could visit your medical doctor. You could literally the next day have a telemedicine appointment with your medical doctor. They'll have the results, and they'll be able to counsel you for sleep apnea. And I know the Academy of Sleep Medicine ideally wants people from suspicion of sleep apnea to have treatment within 2 weeks, but that just never happens. And but now potentially it could, if a person has one of these rings and they get the result overnight, and then the medical doctor can say, you have sleep apnea, here's the risks if you don't get treatment, here's the different treatment options, there's a dental device, and there's the mask and the different things. And then when the medical doctors know about growing the jaws, they can give them that information as well. And then a patient can make a decision. And yes, Lisa Babiak.
Lisa Babiak, she nailed it.
Yes, I'm working very, very hard on getting that included in our healthcare in Canada, because the amount of money this is going to save from the downstream effects of undiagnosed sleep apnea in children and in adults. We have to jump through all the hoops, but it is a dental solution to a medical problem. And we're working on that now. And I think Alberta is leading it with some of the Alberta Innovates and some of the groups that are together that can listen to us clinicians trying to work in the trenches and show the results that we have and prove them, so that medical doctors actually know that there's another option for themselves and their patients.
So many possibilities. This is, like you said, a real game changer. And I can't wait for you and Dr. Chopra to discuss this further. So I'm going to let you catch your breath for a bit, Dr. Heit, and then we'll bring you back after I have an opportunity to chat with Dr. Chopra. Thank you so much for all the work that you're doing in this area. And we will talk to you momentarily, okay?
Thanks, Carrie.
Wow, so exciting. I guess it opens up the door to so many new possibilities. And so, on that note, it is such a pleasure to welcome Dr. Sahil Chopra to the broadcast. Dr. Chopra was born in India and brought up in California. He went to medical school in India and then returned to the United States, doing an internal medicine residency at UCLA and working as an internal doctor for 3 years at Loma Linda University. That was then followed by a specialization in pulmonary and critical care medicine at Loma Linda University. And it was during that time that he became interested in sleep medicine and did a sleep medicine fellowship at Harvard Medical School. He is triple board certified in internal medicine, pulmonary medicine, and critical care medicine, and will take his sleep medicine boards this year. I wonder if he's done that yet. I got to ask him. It's been a little while. Anyway, he's currently working as a pulmonary and intensive care medicine doctor, as well as a full-time chief sleep giver, a CEO. I love how he says that at Empower Sleep. He's going to talk about that. You got to get familiar with that while he talks. Where their mission is to make sleep care simple, widely accessible, and personalized. He is driven to solve complex problems and considers himself a doctorpreneur. And you know what? He is so smart and so awesome. And he's joining us from, I wonder if it's sunny California tonight. Friends, join me in welcoming Dr. Sahil Chopra. It's so nice to see you again.
Carrie, how are you?
Great. Is the sun shining where you are?
Not anymore.
Was it today? Because we have snow on the ground here in Canada.
Taking a nap.
Okay. Have you done your last that I was talking about, your last exams?
Yeah, I just took my sleep medicine boards like 2 weeks ago, 3
How'd
weeks
it go?
ago. I don't know. I mean, I think I'm gonna be okay. Most people tend to be, so I'm not too worried.
Yeah, I don't think you have anything to worry about, but keep us posted because we're all cheering you on and we're so excited to redo this podcast because, like I said, technology wasn't on our side in Las Vegas, was it?
It feels kind of awkward to be doing this now in such a controlled environment.
Right? It does. There's not a bunch of chaos going on. But you were a speaker at the Breathing Wellness Conference. I'm just curious. I want to begin there. What kind of reception did you get to the idea of telemedicine, and what questions from other doctors in different specialties and dentists? What was the overall consensus of what you were hearing?
People are pretty excited. Just like Dr. Heit was saying, being able to deliver care with the patient being in the comfort of their home and the dentist being in the comfort of their home.
Yeah.
People get pretty excited about this stuff. I mean, while Dr. Heit was talking, I was like, so many stories were going through my head. I had a patient reach out to me about maybe a month and a half ago.
Mm-hmm.
And I think she's in her 60s. She had just sent us an email based off of our website that I'm a bed-bound person and I need help. And I heard about this kind of appliance therapy. Could you connect me to a dentist? And we're not even the dentist. So just sort of like emphasizing the idea that there are patients out there. And I think that there's a lot of them who just don't even have the means of making it to a dental office who can provide them this kind of service. So I connected them to the folks over at Vivos and they were going to take care of her. But I think it's really interesting. It's not just that the dentists are looking for this kind of a solution as a career or sleep doctor, but even patients are.
They are
out of a need. They're looking for something like this.
Because you've used this phrase, the silent epidemic of sleep apnea. So, like, why do you say that? That like you're saying, virtual ecosystems are born to battle this silent epidemic. What do you mean by that?
So, like, if you think about when we use the word like epidemic, it obviously means like there's a massive population affected by it. Mm-hmm. And the reason why I think it's silent works well is because 80% of patients who have obstructive sleep apnea are undiagnosed. And sleep apnea affects like close to anywhere between 5 to 10% of the US population. So it's like saying that 10%, like 80%, and that's similar to like diabetes or hypertension. diabetes and hypertension affects about 10% of the population.
Yeah.
And and if anybody said that, 80% of diabetes is undiagnosed, you got to be out of your mind. Like that's
Yeah.
impossible. Or if somebody said 80% of hypertension is undiagnosed, it's like, no, that fundamentally can't be possible. But sleep apnea is like one of those disorders that it affects such a large population, and it's such a massive chronic disorder that
Mhm.
has so much disease burden and so many downstream consequences. Yet 80% of these people are undiagnosed. They just don't know. They've just gotten used to having bad sleep. So that's why I think it's silent. It's an epidemic, and I think we can potentially solve this problem if we all have some kind of a virtual collaborative means of communicating with each other and sort of building an ecosystem around that.
And of course, that's where telemedicine will come into the picture. And as when, Dr. Heit was going through all their slides, the one where you saw patients all covered in wires. And now all you need for a sleep study is a simple ring. Like that's when you realize the possibilities of how telemedicine can come in and take those results and be the game changer. So take it from here, Dr. Chopra.
Yeah, no, absolutely. And that's one component of the problem. But like if we take a step back and we try to think about like how do we solve this, how does this work currently? And
Mhm.
it's like you have the brick and mortar doctor's office, whether that's the primary care who's going to refer you or the sleep doctor who will say, okay, I think you have enough things wrong with your sleep, you need a sleep study. They then refer you to somebody else who then ends up doing a sleep study. That sleep study can either happen in a laboratory setting, or it can be that recorder would be shipped to the patient's home. That sleep study gets shipped off to somebody else to go do an interpretation sometimes. And sometimes it can be that sleep doctor who saw you will interpret that sleep study. The patient then has to go back to that doctor's office to review the test, and then they finally get some kind of therapy for that. They'll be, depending on what's going on, they may refer you to a dentist, or they may refer you to a medical equipment company who will then dispense a CPAP. And this whole process like typically takes like, I wrote here weeks, but it definitely most of the time it takes months. I think
Yes.
the national median is close to like, I don't know, three months or something. And it's sort of, I don't know, people have gotten used to it, but I think this needs to change. I mean,
I agree.
I'm just thinking of like examples in my head of like when I was in fellowship, like I would see a patient, we would order a sleep test, or the previous fellow that was there before me would order a sleep test, and the patient would come back 6 months later to review the sleep test. I would get them started on CPAP. For some reason, the order wouldn't go through. It can just be such a clunky system that patients end up suffering for no good reason.
That's right. And I think you nailed it when you say that this has just become our normal. We've gotten so used to doing it this way. But the reality of telemedicine is it doesn't need to be this way.
Yeah, no, this is really exciting. So like one hypothesis is that we can start off with just doing a virtual visit online. And so much of sleep is like having a good history and asking the appropriate questions to get a high enough index of suspicion that something is wrong. And then after that's done, you can ship the patient a home sleep test. They do a few nights of a sleep study, either with a ring device or any other FDA approved device. And then a lot of these tests are Bluetooth enabled, and they send data directly to the cloud. So we can then review it within 24 hours. We can look at that data, and then we can review the results with the patient at their comfort, and then tell them share with them a personalized treatment plan. And in fact, we can even then connect them to other providers who we think might provide value to them. It could be an ENT doctor, it could be a dental physician, and we can refer them to their brick and mortar offices. So then they can apply all of the personalized therapies directly to the patient, whether it's an oral appliance or a CPAP or any kind of more advanced therapy. If they get connected to the right individuals who are the right providers who are interested in sleep, we can sort of all, as a community, work together to expedite the process and help people get diagnosed and started on treatment.
So who's all involved in this?
It would require like an army, actually. If you look here, this is these are recommendations from the American Academy of Sleep Medicine. Again, we can get into who is involved, but this is just because I don't want this to come across as like I'm saying we need to use telemedicine. I'm just endorsing that the American Academy of Sleep Medicine is also endorsing that telemedicine should aim to promote a care model in which sleep specialists, patients, PCPs, pediatricians, all of these healthcare people need to work together in a coordinated fashion to bring value to patients. And if we look at and we start thinking about who are the people that we would need to have involved, we don't even have to think so much, because the academy is shared with us. These are the disciplines that we need, depending on the different problems that the patients are going to run into. It's going to be dentists, it's going to be OMFS surgeons, it's going to be ENT docs, it's going to be behavioral sleep specialists, it's going to be psychiatrists, it's going to be neurologists and pulmonologists. Like sleep is like that common thing that all of us do. It's like eating, right? We all eat, we all sleep. And there's so many different aspects that other specialties see around this center of sleep, and everybody has their own perspective. And if we all sort of work together to put things together, it can just be a much more successful model, both for the providers as well as the patients.
And this is a beautiful example of what does happen when we do work together.
Yeah, correct. And this is, again, not me saying this. These are coming from people that are far more intelligent than I am at the American Academy of Sleep Medicine, who are proposing these kinds of models. And these models are actually like under one brick and mortar roof, where you have a dentist and you have a sleep doctor and you have ENT people who are all sort of working together in a collaborative way. But it's possible to replicate that in an online ecosystem. Just like Dr. Heit and myself and you are having a conversation today, we can have Zoom in a patient and have a conversation and discuss all of the things that the patient is expressing, and then direct them to the right person, maybe even in their zip code.
Yes.
So this can definitely be done, and we have some exciting stories that patients have been sharing with us.
So speaking of which, what are patients saying? You said the stories that they're sharing. What are they saying?
The fact that they're able to get all of this, the fact that they're able to go from signing up to having a CPAP shipped to their door within 2.5 weeks. And like, you can just see like how many steps are in between, or signing up to getting referred to a dentist in a very like tucked in fashion, in the sense that they've been evaluated by a sleep doctor, they've had the sleep test done, they think we think that they're a good candidate for oral appliance, and they're now sitting in the dentist's office in a matter of 2.5 weeks. That's almost like a 10x improvement from the traditional model.
It is
of a patient going to their PCP, then getting a referral, going to a lab to get a sleep test, then going back to the primary care or the sleep doctor to review the results, and then getting directed to the right individual. So patients are very grateful. Like I work in the ICU. We had a really interesting, an amazing story that happened last week. We had a pregnant patient who had a postpartum hemorrhage. She had come in for a normal premature delivery, had an emergency C-section, had postpartum hemorrhage. They had to do some kind of tamponading procedure, but post-extubation, there was a lot of upper airway edema. Anesthesiologist couldn't intubate the patient, and she coded. So they called an overhead code. So I was in the ICU, so I went over there, and it was like the craziest experience that I've ever had. We did an emergent cryo, bilateral chest tubes.
Oh my gosh.
Like the whole deal. And luckily it's really a miracle. Like, this is one solid mom. I cannot even express how strong she is. And the next day, she was alive. and like the amount of gratitude that like the family had, like that's, you're making, that's a big, massive difference in someone's life.
Yes.
One is able to do. But I feel like we've been receiving similar amounts of gratitude from patients being able to deliver this online. I know it's not like life and death, but it's all about perspective. If somebody is suffering at home and they have an AHI of like 100 and they have like severe hypoxia, and we're able to get them started on therapy in a short period of time and they're sleeping again, sleep is one of those things that if it's broken and it's bad, people don't feel well. And if you can help somebody feel well through improving their sleep, it's just people have a lot of gratitude for that. And it's
totally, it's life changing, because you feel your sleep governs everything in your body. As you're the expert, not me, but I know how I feel when I have a good night's sleep and how I feel when I don't, because it affects all systems. So bring that Empower Sleep QR code back. I want you to talk about that and how we can join and get on the bandwagon of this.
Yeah, so this code is basically wanted to share with all you folks out there who are interested in this telemedicine movement, who are interested in sleep. It's for sleep doctors, dentists, ENTs, psychiatrists, behavioral therapists, anybody who wants to join this online movement and be a part of our virtual ecosystem, so we can help take care of patients in a coordinated and consolidated way. And we'd love to have you on board. This is like not a problem that one clinic can solve or even 50 clinics can solve. This is a problem that it's going to require the entire community, like the entire sleep associated community to solve. And we're just rallying everybody up about and getting them excited about the things that we can all do together.
I love what you're doing, Dr. Chopra, like just paving a new path, and it just makes so much more sense in the day and age that we live in. Thank you for all your work in this area. And I know that Dr. Tammarie Heit wants to join in on this conversation. Like, is that not fabulous, Dr. Heit? That just like brings it home, ties a big bow on everything, right?
Yes, it's amazing. That was a fantastic presentation, Sahil. And I loved your story about the mummy. And I think, that's people used to ask me when I worked in intensive care, how can you work there? So many people die. But no, there's nothing like it when you're a healthcare provider and you can save someone like that, and you've saved that whole family. And you said it. People who when you help them sleep better, I mean, that's breathing. When you don't breathe well, you feel like you're going to die. And if someone helps you breathe, they're really grateful. And this is for healthy people too.
Mm-hmm.
You can always improve your health. Less people are smoking now, and people are eating healthier, and they can sleep healthier too. So, we talk a lot about on these episodes in all different departments. Matt Walker's book, Why We Sleep, is phenomenal.
Mm-hmm.
The obstetrician and gynecologist we had on, Dr. Seth Heckman, and women's health and sleep, that was phenomenal. I mean, just it's so broad. Everybody's got to work together.
Everybody's involved. And as Dr. Chopra showed, that one slide that you had really demonstrate how many different areas of medicine need to be involved in one like treatment plan. It's unbelievable. But with telemedicine, it just streamlines everything. And, you saw months go down to couple of weeks. That's where the change can happen.
Definitely. No, it's really exciting, and definitely a lot of work to be done.
Yes.
A lot of people who are excited about this state, this whole space.
And I can tell you that to the dentists out there, it is possible to treat people by teledentistry. I had to do it in the pandemic. And it worked, and the patients were grateful. They paid because I gave them the option. I go, well, this is just so out there, but no, they really valued the treatment, and they did get results. They can adjust their own devices, which is exciting, because that makes me think somebody in a remote area could get treatment as well.
Mm-hmm.
by teledentistry and telemedicine. So that's what's really exciting about it. But we all got to learn about it first.
It's empowering.
Yeah.
What was that, Dr. Chopra? You cut out.
I was saying it's empowering to the patient.
Empower sleep. I love the play on words there. But I mean, once you go as a patient, and I can lend this perspective, because like I said, even today, I did not want to go in to see my doctor. I don't want to have to drive a half an hour to the office and then sit and wait. And you see how much it ties up everyone's time on my end and on their end. Instead, it was one Zoom call. We met within 20 minutes. All of my questions were answered, and I never left my home. And it just makes sense. And we can do the same with this, as you've explained.
For sure. No, definitely. And you know what the thing is? Like, I feel like the wave is building up because people are more in tune with their sleep than they have ever been before.
Agreed.
With all of these like wearables, whether it's an Apple Watch or a Fitbit or an Android watch, like whatever it might be.
Yeah.
Whoop, like all of in these like smart mattresses. People are like interested in like more of learning more about their sleep and leveraging their sleep to get the most out of the day.
Yeah.
So there's like, it's like you have one side of the spectrum that is all about like performance optimization. Like I need to get the most out of my sleep so I can like knock it out of the park the next day. And then you have the other side of the spectrum who are the people who have like severe obstructive sleep apnea. And through like this telemedicine medium, you can help like that hyper performance individual, as well as you can help that person who has severe obstructive sleep apnea who is just dying every night and looking for help. So it's definitely people have never been this in touch with their sleep, I think, than ever before.
And also, I think a lot of people don't even realize how much it's impacting their life because it sneaks up on them. And I couldn't help but think that when we were in Las Vegas and all those dentists had sleep studies so they could try out this ring, and they're coming back going, oh my God, I have sleep apnea. And well, you better hurry up and fix yourself. But like people feel better when they start getting treatment, and, they're high functioning people, even when they're not getting sleep, but when you can actually feel better and then function better, and you see it in kids all the time, just by getting a restful sleep, it's critical.
Yeah, no, that's definitely true. Like one of the things that I've seen like over and over again is that people, they don't know how bad their sleep was until it actually got better. It's like, they got used to, like, if you have a bad knee and you're limping, to you, you're just in your head, you're used to doing that every single day.
So true.
And then when someone tells you or takes a picture of you and identifies or like shows a picture of you walking, like, oh my gosh, I'm like objectively, like I didn't realize I'm limping that much. And you fix the problem or need replace whatever that may be, and their performance and their functional capacity improves.
Yes,
it's really rewarding. And the same thing like we've been observing in sleep. People don't know how bad their sleep was until it actually got better because, like you said, it just creeps up on them.
So true.
And the kids tell the story because the biggest problem with removable dental appliances is people's compliance and actually wearing them. But the kids love these things. They wear them. They're compliant. They're good at it. They get better. They look better. Kids get better fast compared to adults. But the cool thing is potentially everybody can benefit from a dentist helping this anatomy here.
For sure. My kids are in it. That makes you feel any better.
Well, you too. We are so grateful for this conversation, and it was, so much better to be able to hear you and to hear your messages. Dr. Chopra, thank you for all of the work that you have done and are doing in this area. And I hope that people start to utilize, your services more in telemedicine, because it is the key to making changes. That's for sure. We appreciate the fact that you joined us from California tonight. Keep up the amazing work.
Thank you, guys. Thank you so much for having me.
Thank you. Thanks so much, Sahil.
Bye-bye.
Such a great conversation, Dr. Heit. I know you've been wanting to have that for a while, and we've got it now, and it's going to live on the science of sleep apnea forever now.
Yes. Yeah.
So one more broadcast coming up. And I kind of let the cat out of the bag at the beginning of our conversation. So go ahead and tell us more about why an anesthesiologist and who it's going to be.
Well, I'm very, very fortunate to know Dr. Sam Tammarie, who's an anesthesiologist from Mount Sinai, New York. And we're going to talk about the impact of sleep apnea on receiving a general anesthetic when a person's going for surgery. And not just on that individual person. Like, we need people to understand the impact of having sleep apnea, diagnosed or not, and actually going under an anesthetic, whether that's from a cosmetic procedure or for something to help with pain, like Dr. Heckman talked about. There's so many elective surgeries in women that they have to put off because they have sleep apnea because it's just dangerous. So I kind of want to know, how dangerous is it and what do you do and things like that. So I'm really, really excited about that one. And that's getting close to a public health question. So I would love to have a public health doctor come on here, because what about this silent epidemic of sleep apnea? Maybe it's a secret epidemic. I don't know. Yeah. When more medical doctors find out that dentistry can help and more dentists can help and we can work together, I think we can bring down the cost of healthcare just by preventing the development of sleep apnea and treating those who are affected.
I agree on all fronts, and I look forward to both those conversations. The one with the anesthesiologist is going to be brilliant because I've always thought about that. So, Dr. Heit, thank you so much for all the incredible work that you are doing in this area and the relationships that you're fostering between all areas of dentistry and medicine. You are the game changer in the diagnosis and treatment of sleep apnea, and your passion is palpable in so many different ways. We could definitely feel that, your energy in Las Vegas. It was nice to be around that. So I look forward to the next conversation. And for those of you watching, we hope that you'll come back and join us, and then tell everybody you know. The more, the better to be joining in on these conversations so we can learn together, foster relationships, and battle this secret epidemic and build those relationships and put that final piece of the puzzle in the diagnosis and treatment of sleep apnea, which of course is that collaboration. On behalf of Dr. Heit and I, thank you so much for joining us this evening, and stay tuned for our upcoming episodes. Of course, they'll always be posted on my website. We'll keep you posted with all the details. Thanks for your time, Dr. Heit. Until next time.
Thanks for joining us, everyone.
Good night.
Good night.